Welcome to the Deep Dive. Today we're looking at a really interesting situation in healthcare. Artificial intelligence.
Mm,
It's got this incredible potential. We're talking better diagnostics, helpful virtual assistants, even robots in care settings. Promises more efficiency, fewer mistakes, maybe even saving a lot of money.
huge potential, definitely.
But here's the twist. Despite all those benefits, sometimes patients, well, they push back against AI, they resist it. Why is that?
It does seem counterintuitive, doesn't it?
Exactly. So our mission today is to unpack that exact question. We're doing a deep dive into a pretty recent study from 2025, actually, called Unlocking Patient Resistance to AI in Healthcare, a psychological exploration.
Right, by Sobaih and colleagues. Based on work in Tunisia?
Yeah, interviews, surveys, they really dug into the psychological roots of this resistance. And the findings have some crucial insights for you listening and for how medicine might evolve. We're going to get into the why.
And it's good to set the stage first, maybe.
Yeah.
Just briefly touch on where AI is in healthcare right now and where it's heading.
Good idea.
We're seeing it make medical imaging much more precise, powering predictive tools for patient outcomes, automating things like charting, which frees up clinicians.
Right. The paperwork.
Exactly. And even, AI-driven robots popping up in rehab and care for the elderly. The big picture goal is fewer errors, letting doctors and nurses focus on the complex stuff, the human stuff.
Okay, so that paints a picture of amazing potential, better care, more efficient systems. So here's where it gets really interesting. If AI offers all this, what did the study say is actually stopping patients from jumping on board? What's the block?
That's the core question the research tackled. And it found resistance isn't just one thing. It's significantly driven by three key psychological factors.
Okay, what are they?
The need for personal contact, let's call it NPC. Then perceived technological dependence, or PTD. And finally, general skepticism toward AI, GSAI.
All right, let's break those down. Need for personal contact, NPC. That feels, pretty understandable. We like talking to our doctors, right? That human connection. What did this study add to that?
It really highlighted the depth of that feeling. The qualitative parts, the interviews, showed real anxiety about AI replacing empathy, emotional understanding. That personalized care people feel only a human provides.
So it's more than just wanting a friendly face.
Much more. Patients basically said, yeah, AI might be efficient, but it just lacks that human touch, that sense of being truly understood as a person, not just a collection of symptoms or data.
Okay, that makes a lot of sense. So beyond wanting that human element, what about the second factor? Perceived technological dependence, PTD. That sounds like fear the machine's taking over.
Sort of, yeah. It's about feeling uncomfortable relying too much on technology, especially for something as critical as your health. People worried, what if the system crashes? What if there's a glitch?
Right, the what ifs.
And also a feeling of losing control, making patients feel less involved in their own healthcare journey. Some literally said things like, I want to be in control of my own care. It's about autonomy.
A fear of becoming too passive in your own health decisions.
Pers-
And the third one, general skepticism toward AI, GSAI. This sounds broader, maybe like a general mistrust of new tech. How did that show up specifically for healthcare AI in the study?
It's that underlying doubt, that lack of confidence specifically applied to medicine. People found healthcare maybe too complex, too personal, too important to just hand over to a machine.
Like, can a robot really understand me?
Exactly. They voiced fears about mistakes, misdiagnoses. Some felt like they'd be guinea pigs for tech that wasn't fully proven yet. There was a really telling quote, something like, I'm just not sure I trust a machine to tell me what's wrong with me.
Wow, that really hits home. It's fundamental trust.
It is. And when you put these three together, needing personal contact, fearing dependence, general skepticism, you see why just pushing AI based on efficiency isn't enough.
So connecting these dots, what does it mean for actually using AI in hospitals and clinics? You can't just ignore these feelings.
Absolutely not. The big takeaway for healthcare providers, for anyone developing these systems, is that you have to balance the tech with the human. Strategies need to actively preserve that human touch patients value so much.
So, using AI as a tool for the doctor, not instead of the doctor.
That's a big part of it. And also, addressing those fears about dependence head on, being transparent, building trust slowly, maybe through gradual exposure where patients see the benefits but still feel in control. It's not about rejecting AI, it's about integrating it thoughtfully.
Right, so it doesn't feel like it's stripping away the care part of healthcare. Okay, so for you listening, whether you're a patient now or might be in the future, knowing about these psychological drivers, that need for connection, the worry about relying too much on tech, that basic skepticism, it's really important for understanding how AI might change your experience.
And it leaves us with a really crucial question to think about, doesn't it? As AI keeps getting better and more integrated, how much human interaction are you personally willing to trade for potentially more efficient or innovative healthcare? Where do you see that balance between the human element and artificial intelligence in your own health journey? What are your expectations?